access that through the web, but I did want to mention to everybody that this webinar is being recorded today. The webinar is open for task force members. Like I said, we did have to mute the lines because of the feedback. If you're a task force member and you'd like to speak, you raise your hand by clicking on the little yellow hand on the control panel. As for public input, there won't be input from the public today, but we are working on various methods through email, through public comment in official meetings, and some other methods to ensure that we do have adequate amount of public input because the task force is wide and diverse in the members that are on it, but we know that there's a lot that we can garner from members of the public who have a concern about these issues and who work in these issues as well. So with that, I'll turn it over to Secretary Corley to get us started.
Good afternoon. This is Chuck Corley. I'm the Secretary of Florida's Department of Elder Affairs, and I'm pleased and proud to be hosting this first and inaugural meeting of the Purple Ribbon Task Force. I want to thank everyone for joining us today. It's a huge job you've got in front of you, and a limited amount of time to get it done in, and we as a department will be providing administrative support to the task force to facilitate you along in your mission as outlined in the statute. So thank you all for joining us. I want to thank Representative Hudson and Senator Richter for sponsoring the legislation that created the task force, and I also want to thank all of the members who have agreed to serve. I know it's no small task committing to something like this, and we at the department and Florida's 450 to 500,000 residents who are plagued with or suffer with Alzheimer's disease and related disorders, thank you for your time and your contribution and the sacrifice you make by agreeing to be a part of this this important endeavor. Currently, 24 plans throughout the state have developed their own state plan for dealing with Alzheimer's and working with Alzheimer's and dementia within their states, and I think that's where we'll be headed with this. I feel that Florida's contribution to this dialogue will be sizable and significant on a national level. We, as I mentioned earlier, the Department of Elder Affairs will be providing administrative support to the task force. None of us are members of the task force, but we have a number of people here in the room today that stand ready to provide research, support, writing skills, whatever, to help us accomplish what the task force has to get done. I want to point out 3 key staff that you'll get to know today, and then perhaps others as time goes on. First, many of you've all heard Josh Spagnola helping get things started and helping coordinate the technology and all of that this morning to make this happen. Josh is our Legislative Affairs Director, and Josh will be the kind of single point of contact here at the department if you need access to any of the resources or information that you can get through the department. If you have questions and all, you can feel free to give Josh a call, and he'll be sharing, I think, his contact information through the course of the meeting or some point during the meeting. Secondly, our Manager of Strategic Initiatives here at the department, Mindy Solish, is here to join us. She has some information, initial information, that she's going to offer. She's done a bit of research in this area in terms of other states and all, and she will be a resource and will also make you aware of other resources that we can make available through her, through the department. Things we've talked about is if the task force wants to do any kind of surveys or anything like that, we have some, albeit somewhat limited, but we do have resources for that within the department to construct that sort of thing and work with you along those lines. I offer that up just as an example of the sorts of things that Mindy can bring to the table. Lastly for today, Teresa Goodson, one of my assistant general counsels, is here today to talk about the ever-important Sunshine Law and its impact on groups like this and our participation in meetings like this, the do's and the don'ts. I just urge you up front to hear her out, to ask any questions you may have, and to take seriously what she tells you. It's a real problem within a group when you have things that can be construed as violations of sunshine law, and she'll tell you what is and is not a violation. Josh will be sort of a safe harbor. Any of you can talk to Josh at any time and ask him any questions or get clarifications on anything. If he can't give them to you firsthand, he'll find the professional resources or the expert in the subject matter that you're looking at. So when we get talking about sunshine law and all, a lot of you will think, well, I can't talk to anybody, I can't do anything. Just remember, Josh is there and you can communicate to him. There are things that Josh can and cannot do on your behalf, which I think we'll explain during that conversation. So again, as I mentioned earlier, the time that we have available is short, so we're trying to make this to facilitate the work group, the task force, as much as we possibly can, provide support that you're going to need moving forward. And I look forward to seeing what we can accomplish in that. Now, one of the first things we have to do, I think, to kick us off, and I'm not going to talk too much longer, but the law creating the task force was silent to, while it spoke very specifically to how the group as a whole would be constructed and what skill sets or what knowledge base and experiences individuals will bring to the task force, and they are varied. It did not talk a lot about the structure in terms of a chair or one thing or another like that. So while I am, again, no one from the department, including myself, is formally a member of the task force, and therefore I cannot make a nomination, but I will make a recommendation to you that Representative Hudson start things off by serving as the chair or leader or whatever you want to call it of the task force. I make that recommendation for a couple of reasons. One, that he understands probably better than anyone the purpose of the task force, the goals the task force is supposed to achieve, and the vision that that is supposed to be encompassed into the law creating the task force. And additionally, I know from firsthand experience that he knows how to conduct a productive meeting. He knows when strict adherence to things like Robert's Rules of Order are appropriate and when a more open, congenial format for discussion might be appropriate. So with that, I would make the recommendation that Representative Hudson start off as our chair to kick us off. And boy, I'm hoping he's on the line after all of that. But with that, I'll turn it over to Representative Hudson and see if he is willing to accept my recommendation. Representative Hudson.
Representative Hudson, can you hear us?
Can you hear me now?
Yes.
Hello?
Yes.
You scared me for a minute.
I have a way of doing that for people. First of all, I want to thank you for your leadership, Secretary, and helping to put all this together. I also want to thank you for your kind comments and suggesting that I take on a role of chairing this task force. I'm not sure procedurally where we go from here, but I suppose if there's a member of the task force that might want to make that nomination official, I think that would be the first place to start just procedurally, and then from there we can see if there's any objections and move on. So Josh and Secretary, with you're having the technology at your fingertips, if there's anybody clicking on their little raise your hand buttons right now, I guess that'd be the first place to look.
Okay. There are a couple. Try to go in order. Christine Powers. Go ahead, Christine.
I'm sorry. I must have been just fiddling with the buttons here.
Okay.
I had no question.
Not a problem. Amy Perry. All right, Amy Perry, can you hear us? All right. Mary Barnes, this is Josh. Go ahead.
Is Chris going to make the motion and I'll second it? Is Chris making the motion or do I need to make the motion?
We are looking for a motion now.
Select Representative Hudson to be chair of the Purple Ribbon Task Force. Can I have a second, please?
We have two members here in person, Natalie.
This is Natalie Kelly. I second the motion.
Okay.
Okay, I guess all those in favor, if they're, it's hard to do via the voice thing, so I guess if there's any objections, please click your raise your hand button. Otherwise, let's assume the nomination shall stand.
All right, give us a quick second. We're taking the hands off, and at this point, if there's any person that has any reservations or comments, we'll recognize you. Go ahead, Christine.
I don't understand. My hand keeps going up, but I'm not touching anything. I'm sorry, but no, I'm in favor.
Okay, we appreciate it. Is there anybody else who has comments or any reservations about the nomination of Representative Hudson in the second for chair of the Purple Ribbon Task Force? All right, we don't see any. So with that, I guess the motion's adopted. Representative Hudson, congratulations. And with that, if you like, we can turn it over to you for introductory remarks.
Thank you, Josh, and I appreciate you and your technical team working through this. I'm sure as we have additional meetings, we'll all be exceptionally tech savvy and probably impress a lot of our coworkers at that point. Members of the task force, the first thing I want to say is thank you. Thank you for your willingness to serve. For many of you, this is a very, very personal issue, as it is for me. And I will tell you, when I took on this piece of legislation in the spring, it was a personal issue. Like many people in our state, in our country, and probably many of you, I've had a personal issue with Alzheimer's. And it was not a good experience with Alzheimer's. And so my motivation for doing this, quite frankly, the first thing I want is to have us find a cure, but absent that cure, I want the state of Florida to have the best coordinated, logistical, passionate approach to addressing the Alzheimer's and other related dementias that is clearly coming onto our state in epidemic format. And so that's why I did this bill. Senator Richter was my Senate sponsor, and I can assure you that he had the same passion. He is a diehard advocate for Alzheimer's, and something that we both, we share an office back in Naples, and something we both are just committed to. I know that Becky Kokonos is on the line, and I know that she's probably nodding her head. I will tell you that as we move forward with this, you all were selected for this task force because you all come to the table with a great deal of expertise and, more importantly, a unique set of skill sets. When this piece of legislation was put together initially, we did not have this many members of the task force. And we expanded the task force to be able to bring in more people with more diverse ideas, with greater expertise, so that truly, at the end of the day, we will have a work product that Secretary Corley alluded to that I hope to be the model for the country. I will also tell you that I plan to be very aggressive in bringing that model forward to the rest of the country. And so with that, I tell you, let's engage in this task force. Let's recognize that we have a tremendous amount of work to do in a very short order. Our first interim study is actually due by January the 30th, so we will we'll get really good at this technology really quickly. But I think at this point it would be appropriate to do an introduction of the members, and then I believe if DOA staff wants to wants to address the group, that would be great, and then we'll do the sunshine laws. So Josh, if you'd like to break down the group and unmute each of their buttons, and we'll hear from each of them, just a brief 1 minute from each one if we could. Thank you, members.
All right. We appreciate that, Representative Hudson. We will start. I'll just go down the list, and I'll let the two task force members that are here just speak at the end. We have Dr. Goldie, Would you like to just give us an introduction? And with these introductions, just for time's sake, keep it around a minute. That would be great as well. So Dr. Goldie.
Okay, yeah, hi, my name is Todd Goldie. I'm at the University of Florida, where I direct the Center for Translational Research in Neurodegenerative Disease. I've been in Alzheimer's disease research for over 25 years. I started when I was getting my MD PhD degree, and I think at that point when we were unraveling some of the sort of basic tenets that we think are the root causes of Alzheimer's disease, we thought we'd be a lot further on with respect to developing therapies. And so I think we all recognize that Alzheimer's disease is a major unmet medical need, perhaps the major unmet medical need. And I also am involved at the national level as a member of the National Alzheimer's Association Medical and Scientific Advisory Committee, and as well as on other sort of national levels activities with relating to Alzheimer's research. So I think I could bring both a local and a national perspective to this.
Great. Thank you very much. Darren Brooks. Go ahead, Mr. Brooks.
Okay, this is Darren Brooks. I'm a director of rehabilitation at a skilled nursing facility here in Naples, Florida. And one of my tasks that I've been doing for the past 10 years in a skilled facility is working with both residents who are going to be long-term or short-term with doing rehabilitation with them, getting them back into the community, working with community resources, working with nursing department, social services, and all the different departments related in the skilled nursing facility. So I fought with different commercial insurances, with Medicare and Medicaid on getting reimbursement for therapy services for the dementia patients and Alzheimer's patients. So I hope to bring that view to the task force.
Thank you very much. All right, Amy Perry.
Hi, my name is Amy Perry. I'm the Senior Vice President and Chief Operating Officer at Mount Sinai Medical Center on Miami Beach. We are the home of the Wien Center for Alzheimer's Disease and Memory Disorders. We are the largest memory disorder center in the state. We do comprehensive research. We're involved in national trials. We provide a lot of clinical care to patients and also a lot of caregiver support. Mount Sinai's focus is on geriatric care here in Miami Beach, and we have a long history of that in serving our geriatric population. And also, just to add my personal experience, my grandmother suffered with Alzheimer's disease for 7 years, and so I know firsthand how it impacts families. So just both personally and professionally, I'm committed to helping this committee achieve its goals.
All right, welcome and thank you. We are having a little bit of technical difficulty with Samira Beckwith, so I'll just say a quick word. Samira Beckwith, many of you already know, but she comes to the task force as a representative from a healthcare facility or hospice. She runs Hope Hospice and Healthcare in Southwest Florida. And like I said, we are having a little bit of technical difficulties, but I know that she'll be contributing a lot, and we'll get to know all you through the process. And if she has any comments, we do have some messaging that we're able to go back and forth, and I'll relay her comments to the group. Becky, if you would like to say a couple words on behalf of Senator Richter, that would be great.
Sure, be glad to. Senator Richter first apologizes for not being able to get on the webinar. He's somewhere where he can't do that, but he does apologize. I think Representative Hudson covered it pretty well, his dedication, his commitment to the Alzheimer's patient and to the families and to the organizations that service those folks. I'll be on every call that he can't be on. Hopefully we can bring this all together. I think Florida is going to be a leader in the nation for Alzheimer's plans. Thank you.
Great. Thank you very much. All right. Mary Barnes, welcome. Yes, go ahead.
I don't know. Mary Barnes, I'm President and CEO of Alzheimer's Community Care, which serves Palm Beach, Martin, and St. Lucie County. I have been working in the world of Alzheimer's since 1983, and we have a huge community, the highest incidence rate of Alzheimer's probably in the state between Palm Beach, Martin, and St. Lucie counties. We're a community-based organization. We are where the rubber meets the road. We are very proud of our involvement, and we thank Representative Hudson, and we thank also Senator Richter for supporting the Florida Silver Alert program, which I think everybody's very proud of. I think it's a national model, I'll be honest with you. And also the legislation that we just passed for the standards of care. And I guess that's where our heart is as far as helping families live with this disease, not just die with them, not just having them have the option of just needing to go into a nursing home. They want to live in the community. They want to have their family members at home throughout the duration of the disease. And that's going to be the future of Florida, because we need to help these families realize that dream and that vision. And that's what Alzheimer's Community Care is all about. We do partnerships with churches, and we have 9 dementia-specific daycares throughout the 3 counties, besides the family nurse consultants and the 24/7 crisis line. So we are truly where the rubber meets the road, and I guess I'm one of the few lonely specific providers, but it's an honor to sit with such prestigious people, and the cards are all in the right place. And I feel very privileged to be able to do this, and I thank the President of the Senate for giving me this opportunity. Thank you very much. I'm looking forward to the future and coming up with a dynamic models for the country. I've already started in some spheres, which is the Florida Silver Alert. So thank you so much.
Thank you very much. Dr. Neil Graff Radford.
Thank you very much. I wanted to thank the Senate for allowing me to serve on this committee. It's a real honor. I'm a neurologist. I work at the Mayo Clinic in Jacksonville. I've worked in the area of Alzheimer's and other dementias for more than 30 years. I bring a clinical perspective as well as a research perspective. Nationally, I'm part of the Alzheimer's disease research centers. Mayo is one of the centers, and I serve on that board. I'm also part of the Alzheimer's Disease Cooperative Study Group, which is planning the first secondary prevention study in Alzheimer's disease, and I can bring that information to this group. I have also been a member of the Alzheimer's Disease Initiative for many years and served on the Alzheimer's Disease Initiative in the state of Florida. So I very much look forward to working with this terrific group of very knowledgeable and skilled people.
Great. Thank you very much. Scott Solkoff.
Hi, I'm Scott Solkoff, and can you hear me okay?
Yes, we can.
Okay. Hi, everybody. I'm a board-certified elder law attorney, and there are 1,600 members of the elder law section of the Florida Bar. You know, the Florida Bar is broken into different groups of different types of attorneys, and these 1,600 members of the elder law section work with tens of thousands of elders, their caregivers, and their families, mostly of modest means, but many of whom, mostly, are suffering from Alzheimer's or related dementias. I'm an author with my father of a 1,000-page treatise textbook on elder law for attorneys. That's now in its 14th edition, and we have a chapter in there about Alzheimer's disease and related dementias and how that affects elder law planning that we're constantly updating, because there are so many changes, both in practice, mainly in practice, but also in the actual statutes. I don't speak for any of the following organizations, but I do want my fellow task force members to know that I will be able to get input from certain organizations that may be helpful to us, and certainly to share information with them. And I'm a past board member of the National Academy of Elder Law Attorneys. I'm past chair of the Elder Law section of the Florida Bar. I'm past president of the Academy of Florida Elder Law Attorneys, and a fellow of the American College of Trust and Estate Counsel. And these are all organizations that have done quite a bit of research. Some that I've been involved with, much of which I have not personally been involved with, but that rely upon heavily and will share with this group. And so I hope that's helpful to you. I've reached out to my community and solicited input, and I'd like to hear more about the process for doing that with regard to sunshine laws. But I think that would be a helpful role for all of the task force members to be able to reach out into their constituents and bring in information that we could all benefit from. So thank you, and I appreciate the appointment.
Thank you very much. I think we might be able to hear from Samira, so we're going to try real fast. Samira, can you hear us? No? Okay, we're still having a little bit of difficulties. We'll work on that. All right, Gloria Smith, go ahead.
Good afternoon. I'm Gloria Smith. I'm the president and CEO of the Alzheimer's Association Florida Gulf Coast chapter. We cover 17 counties along Florida's Gulf Coast. I have 3 counterparts, other chapters that cover the remaining part of the state. But our mission is the care of the caregiver. It's taking care of these families, including, providing emergency respite, individual and family care consults, support groups, caregiver education, physician outreach, some specific new programs for early and younger onset families, 24/7 helpline. It's actually accessible in 141 languages. But one of my priorities, as well as service, is ensuring Alzheimer's families have a voice in the decisions that are made that affect their lives, not just locally, but at our state level as well. I worked on the team that kind of created the language for this legislation, and I envisioned experts like we have here today. This is really exciting. That have all kinds of experts in the field of Alzheimer's. I'm really looking for this group to be visionary. I may be from the Alzheimer's Association, but I'm not just representing the Alzheimer's Association. We can all look big picture, and I think our families that are living with this disease are really counting on us to be able to have services and a system in place that's going to benefit them. So I do very much appreciate Representative Hudson and Senator Richter. They did not hesitate a second in agreeing to take the lead and champion this effort. So thank you, and I'm excited, and I'm ready to get to work.
All right, thank you very much. Ted Wolfendale.
Good afternoon. My name is Ted Wolfendale. I'm the president of Nevco Healthcare. We create educational training programs and Alzheimer training programs for caregivers and nurses in all 50 states. Closer to home here in Florida, we're approved through the Department of Elder Affairs for Alzheimer programs to train caregivers and nurses in hospice facilities, in assisted living facilities, in nursing homes, and in home health. I'm active with the United States Department of Commerce. I travel with them overseas. Last February, I was the U.S. representative at the European Union at a Summit of Nations where we discussed healthcare and Alzheimer's. So I'm very much looking forward to the opportunity to lend what experience I have from the perspective of training the folks that are out there day to day. I'm also an attorney. I'm active in the health law section, so perhaps I can work with Scott in the elder law section. That's where my expertise is, and I also would like to tell Representative Hudson, I agree with him. We need to work to come up with a coordinated, logistic, and passionate approach, and I really appreciate the opportunity to sit on this board with so many excellent people. Thank you.
All right, thank you very much. Jamie Glavich.
Hi, this is Jamie. I got involved with Alzheimer's care about 25 years ago when my mother was diagnosed. She was at the age of 60. We didn't have a lot of resources up in the Jacksonville area, so I formed my own assisted living and adult daycare centers about 20 years ago, and I have 3 assisted livings and 2 daycare programs. And recently been serving on the ADI committee for the last, I think, about 4 or 5 years, and recently as chair. And just really involved in Alzheimer's care and out there teaching caregivers and working with families. So I'm looking forward to us progressing with this.
Great, thank you very much.
Thank you.
Albert Johnson.
I'm Albert Johnson. I'm a member of the fact that I have Alzheimer's. I have worked as a lawyer, teacher, high promoter, and those activities have been greatly diminished by my condition. I'm sitting here with my lovely wife, Dr. Yvonne Johnson, who helps me now more than ever in daily routines, and I'm very, very proud and happy to be part of this organization.
Great, thank you very much. And 11.
Yes, hi. This is Linda. I am the executive director of ElderSource, which is the Area Agency on Aging and Aging and Disability Resource Center for 7 counties in Northeast Florida. And I also serve as president of the Florida Association of Area Agencies on Aging. I have my master's in gerontology, which included a focus on Alzheimer's, and of course, so I have an interest in that as well. And I have worked with various area agencies on aging for over 25 years, 3 of which are in Florida, currently in Jacksonville, but also Broward County and Miami-Dade. And area agencies on aging provide funding for programs and services to help individuals with Alzheimer's or related dementia. And so we have that responsibility, but also as Aging and Disability Resource Centers, we help older adults, including and especially folks with dementia, to get the resources they need to age in place and remain as independent and age with as much dignity as possible, which is so important for those with Alzheimer's and for their caregivers. So I'm here both representing my organization, but also the Florida Association of Area Agencies.
Great, thank you very much. And there was a little... We'll do after the meeting on that connection, but we were able to hear you. Okay. Stacy Payne.
Yes. My name is Stacy Payne. I work with the Lee County Sheriff's Office. I've been at the agency for over 16 years now, have worked in a variety of positions, including on the road. More recently, my role has been in our Community Relations Division, overseeing that division, which includes our senior services. I am currently the co-chair of the Lee Elder Abuse Prevention Partnership, which is a coalition among our area service providers where we look at promoting and educating the community and caregivers on elder abuse, neglect, and exploitation, and trying to make sure they have the right services in place. Also, I'm an instructor with the Federal Law Enforcement Training Center on elder abuse investigations and convictions, national instructor on the Communities Against Senior Exploitation, and a senior instructor with our Project Lifesaver program. That program is a program designed to help find those who have Alzheimer's, dementia, or autism if they happen to wander off. I also instruct for the the Florida Attorney General's Office on elder crime prevention, sexual assault prevention, and crime prevention with those with limited abilities. And currently we're working with the University of Illinois and their Center for Public Safety and Justice, looking at the proactive ways that law enforcement and the community can partner together to protect those persons with Alzheimer's disease and related dementias.
Great, thank you very much. All right, Christine Powers.
Hi, I'm Christine Powers, and I work with Community Aging and Retirement Services up here in Pasco County. I have been in the long-term care business since about 1985. I do sit on the ADI committee, and that is who I am representing. I'm very proud to do so and to be among such experts in the field. I also have been recently elected as the Florida Adult Day Service President, so I'll be serving that for the next year. And over time, I have sat on the National Adult Day Services Board for about 8 years and served as secretary there. We're very proud to have started here in Pasco County some of the early memory loss programs and focusing on mild cognitive impairments, as well as even taking it a step further to those that are just, kind of forgetful with a Strengthen Your Mind program. I'm looking very forward to working with this group, and having been a caregiver myself to my mother with dementia and a user to many of the services, hopefully I bring some of that sensitivity to the table. I'm also usually known as out of the box person, so I'm hoping that we could come up with some very creative, innovative suggestions and recommendations that will help us with the care of Alzheimer's and their families. And taking a look at where we are now and where we need to go into the future, using not only human resources, but also taking a look at the world of technology out there. Thank you.
affordable and fair housing, and I've also served as the housing assistance coordinator for the state emergency response team during hurricanes Aaron and Opal. So I am have expertise in applied research, and I am looking forward, because of personal reasons and because of professional reasons, to do everything possible to help make this a successful project. Thank you.
All right, thank you. And also here at the department is Natalie Kelly.
Thank you, Josh. My name is Natalie Kelly. I was appointed by Speaker Dean Cannon to represent the disaster preparedness part of the task force. I want to stop before I go on and talk about myself to thank, again, Representative Hudson and Senator Richter for making the Purple Ribbon Task Force a reality, for allowing, for Becky Kokonos allowing me to live in her office for several months. I was the one who actually lobbied this legislation, and I lived and breathed it. And I also want to thank Gloria Smith for actually saying this is the year we need to do this, because it's extremely important. And so again, thank you all for advancing this issue. I started with Alzheimer's, dealing with Alzheimer's back in 2000. I was a public policy director for the Alzheimer's Association for the state of Florida. And even though a lot of people know the Alzheimer's Association for taking the leadership role in Alzheimer research, at the state level, we really focused on caregivers. And in those few years that I was a state director, the chapters of the Alzheimer's Association passed legislation that created dementia-specific training for employees of nursing homes, and that was way back in 2001. And then we also did legislation that created dementia-specific training for adult daycare, for home health agencies, and for hospice as well. We funded and created a memory mobile, which is a role model for the nation. It's a mobile unit that travels around the underserved areas in the Gulf Coast area and has been championed by both, to keep the funding by both Senator Richter and Representative Hudson. We also worked with the Speaker, Johnny Byrd, way back actually in 2003, to make Alzheimer his top priority. That's the first time we've ever had somebody at that level to make Alzheimer a top priority in his term. Also, what we did is we worked on funding for statewide programs that train law enforcement officers about wandering, about the issue of wandering. We also funded a statewide program that reached out to underserved minorities and underserved areas and rural areas. Very successful programs. We also worked with the Area Agency on Aging, and I know that Linda is very familiar. Linda Levin is very familiar with this because we got $3 million in the budget during a year that it was not going to be placed in there, to create ADRCs, Aging and Disability Resource Centers. We also actually convinced my brother at the time, who was a state representative, Kurt Kelly, to work with the governor, Governor Christ, to create an executive order that created the Silver Alert system, and we're very proud about that. I moved to Washington, D.C. in 2007 and lived there for 2 years, where I worked with the National Alzheimer's Association. My job was the director of systems change, and what that was is I oversaw all the national Alzheimer grants. So what I bring to the table is the fact that I know the programs that work in other states, and I know the programs that don't work, and I hope that we can utilize that. I work with Josefina Carbonell, who at the time was the Secretary of the Administration on the Aging, who so happens to be from Miami, Florida, and her focus was disaster preparedness and minority outreach. And because of that, we did a lot of work on disaster preparedness, and I went around the nation to speak and make presentations about national disaster preparedness and recovery. Back in 2008, I moved back to Florida, started my own business, where now I do lobbying, campaign work, and also public relations, but I do represent the Alzheimer's Association, and where we work to create this Purple Ribbon Task Force.
All right. Thank you very much, and I think that's it for member introductions. Representative Hudson, did you want to add anything at this point?
Thanks, Josh. You know, I had seen the list of names of the people that were appointed to this task force, and boy, hearing about everybody's expertise really makes me optimistic about the things that we'll be able to accomplish. That's for sure. What a sharp group we have. I think next on the agenda we have just a brief moment from DOA staff. If they want to if the ones that are in the room, if they could at least say hi. And then if we could get on to the Sunshine Law presentation, I think that would be appropriate so that we knew the guide rules that we have to work from. I will tell you, to each one of the members, if you have never participated in a committee, task force, appointed board of any type as it relates to the Sunshine Law in the state of Florida, this is one of those things that you just have to pay attention to, and we have to be completely on board with this. It is very important, and it is something that we want to make sure we are always on the right side of. We would never want anything to come back and reflect negatively on the good work that will be the outcome and work product of this committee. So, again, if we can have Elder Affairs staff introduce themselves, say hi, and then if we can get Ms. Gleason to do the Sunshine Law presentation, that would be fantastic. Thank you, Josh.
All right, thank you, and I'll just briefly mention the DOEA staff. I know and after this legislation was passed and even before, we were looking at it, sort of planning what our involvement would be, and Secretary Corley, I know, wanted to devote as many resources as possible to make sure that this is successful. So I just wanted to name a couple people who are ready to start working and assist the task force as they see fit through this process. Secretary mentioned Mindy Salish, the Manager of Strategic Initiatives here. Also, we have Corey Livingston, who is the Alzheimer's Disease Grants Coordinator here at the department. Carol Waters, who's a contract manager in the Bureau of Community and Support Services. Kim Delvecchio is an analyst in the Bureau of Community and Support Services. Danielle Bist, administrative assistant in the same bureau. And the department is also working on potentially having an intern come for the duration of this project to assist the task force and staff at the department that are assigned roles as we move forward, both through the initial draft and the final report. So I just wanted to mention that you all have a tremendous amount of resources, as the Secretary mentioned, and feel free to lean on us as much as you need. If you like, Representative Hudson, we can go right into the Sunshine presentation.
Thank you, Josh. That would be excellent.
Good afternoon. My name is Teresa Goodson, and I'm an Assistant General Counsel with the Department of Elder Affairs. I want to thank you, Representative Hudson, and all of the members on this very important task force for agreeing to dedicate a year to address these issues of Alzheimer's. And I, like Mr. Sangola, was very impressed with all the members that are on this committee. We appreciate your service. I'm going to present today a very brief summary of the Government in the Sunshine Law, which is commonly known as the Sunshine Law. I know that many of you, based on your brief introductions, probably have a great deal of familiarity with the Sunshine Law, and this summary is meant to hopefully refresh or highlight the major points for you. The Sunshine Law was enacted in 1967, and it's found in Chapter 286 of the Florida Statutes. Josh has provided to all the panel members an excellent overview of the Sunshine Law, which was prepared by Patricia Gleason, who is a member of the Attorney General's office. I recommend this as a guide for each of you to keep and use. Additionally, there are excellent resources online referenced in the back of that handout that are found at the Attorney General's website. In fact, there is a manual called Government in the Sunshine Manual. This is a very good resource that can help guide you on Sunshine Law issues as you may encounter them throughout this year working on this special task force panel. The Sunshine Law is based on just a very simple premise that there is a public right of access to meetings of boards, commissions, and other governing bodies of state and local government agencies, which of course includes the members of this task force. The benefits of the Sunshine Law is that it creates transparency, and that promotes accountability and fosters consistency and fairness in our government. The courts have consistently upheld the Sunshine Law, having a very broad scope. The Sunshine Law applies to both state and local, elected and appointed officials, and it applies to any gathering of 2 or more members of the same board, which would be discussing any matters that may foreseeably come before that board for action. This sounds very simple. There are 3 basic requirements to satisfy the Sunshine Law. The first one is that all meetings of public boards or commissions must be open to the public. Number 2, reasonable notice of the meetings must be given. And number 3, minutes of the meetings must be taken, promptly recorded, and open to the public for inspection. These requirements apply to an organizational meeting like is occurring today with the task panel. This meeting is in fact open to the public. Notice has been provided, and it's being recorded electronically, and it will be open to the public for inspection. I believe Josh has worked that it will be on a webinar, a webcast that will be available to the public. Advisory boards are created pursuant to law or ordinances or otherwise established by public agencies are subject to the Sunshine Law, even though their recommendations may not be binding upon the agencies that create them. A committee that is established to act in any advisory capacity is subject to the Sunshine Law. This task force, which was created to prepare recommendations for the governor and the legislature, is accordingly a subject to the Sunshine Law. The Sunshine Law does not apply to the legislature or the courts, but individual legislators that are appointed to serve on a board, of course, would be subject to the Sunshine Law and the same requirements as other board members when acting on that specific board. Meeting of staff members of a board are not ordinarily subject to the Sunshine Law unless that staff member is appointed to a committee, which would be delegated authority, which would be within the Public Board or Commission. At that point, the staff member would lose his or her identity as a staff member while working on the committee, and the Sunshine Law would be applicable to that staff member. At this point, the staff members from Department of Elder Affairs are not members of the Blue Ribbon Task Force panel and would not be subject to the Sunshine Law, but it'll be something that as you work through the process should be closely examined, the roles of staff members on this panel. The Sunshine Law has a very broad scope. Our courts have consistently upheld a very broad interpretation of Sunshine Law. And today, the Sunshine Law applies to telephone conversations, written conversations, and all electronic communications through electronic media. In our world of instant access by multiple electronic media, it's very important to consider the broad scope of the Sunshine Law. For example, it's been determined that communication by board members on a Facebook on issues that could foreseeably come before the board would be required to come within the scope of the Sunshine Law and the openness of the Sunshine Law. That certainly is a new type of media that we all have available, and we should be mindful that that is something that falls within the purview of the Sunshine Law. Board members may not use email or the telephone to conduct a private discussion about board business. Board members may send a one-way communication to each other as long as the communication is kept as a public record and there's no response to communication except at an open public meeting. For instance, Mr. Spangola will be very helpful in communicating with each of the board members, and there may be a position or information that you would like presented to the board. It'll be important that that is presented to Mr. Spangola and he makes sure that it is forwarded to all of the other members and to be presented at an appropriate open meeting, but not discussed among any individual board members except in meetings that are open to the public and comply with the Sunshine Law. The Sunshine Law applies to both informal and formal meetings and to any gathering where there's any discussion of matters that may foreseeably come before the board. Members of boards are very commonly appointed with one another, and there are friendships often where there are meetings in social settings of board members. That, of course, is permissible. However, the board members must always be mindful that they are not permitted at any social settings to discuss any information or matters that may foreseeably come before the board. So that is an important point for members from such a diverse group as this to keep in mind in other settings where you may meet one another and discuss issues that could possibly pertain to the Sunshine Law. To be mindful of that and to avoid any discussion that would fall within a matter that could come before the board. Now, the Sunshine Law only applies to a discussion between two or more members of the same board or the same committee. So, for instance, an individual board member would not be prohibited from talking about board business with staff or with non-board members. For example, a board member will have the opportunity and probably will be have communications with members of the public who may have an interest in the issues that are before this board, and that is permissible. This would include possibly providers that are involved in the Alzheimer's area, possibly lobbyists. They are entitled to speak with the non-board members about these issues. However, the board member must be mindful to not discuss these issues with another board member except at a meeting that would comply with the requirements of the Sunshine Law. Another example, which is given in the handout, is where if a board member contacts staff to discuss an issue, the board member cannot ask staff to find out the opinion of the other member from that discussion. That would be a polling of the board, and that would be violation of the Sunshine Law. So if you just remember that it is only individual board members talking with non-board members that is permissible about issues that fall within the purview of the panel. Board meetings must be open to the public. Boards may adopt reasonable rules and policies to ensure the conduct of the meetings, and the boards are not allowed to ban the public from videotaping, tape recording, or photography at the public meetings, as long as it's not disruptive. I believe this webcast is made available for the public to hear and attend the same as the board members, so that falls within the purview of the Sunshine Law. The board meetings should be held in buildings that are open to the public. They cannot be held in any facility that would discriminate on the basis of sex, age, race, creed, origin, or economic status. The phrase open to the public means open to all who choose to attend. No one can be excluded from a meeting that must be held under the purview of the Sunshine Law. And of course, it's important to remember that there are penalties for noncompliance with the Sunshine Law. Any member of a board or commission who knowingly violates the Sunshine Law would be guilty of a misdemeanor of the second degree. An unintentional violation would also could be prosecuted by a non-criminal infraction, resulting in a civil penalty of up to $500. Additionally, if there has been action taken by a committee that is not within the purview of the Sunshine Law, then any decision or action taken would be non-binding on that committee and would be considered void ab initio, which would mean basically it would be invalid from the outset. So penalties for the Sunshine Law involve not only personal penalties for anyone who would violate it, but also it would result in any actions taken by those violations as being invalid. This is a very brief summary of an overview of the points of the Sunshine Law. I hope it's a helpful reminder to you that have familiarity with it. If you do have questions regarding the Sunshine Law, or as you work through the year on this panel, if you have questions, you're welcome to direct those to Mr. Spagnolia, to Josh, and he will forward them to the General Counsel's office for a response for those questions. Thank you all for your time.
Representative Hudson, yes.
Thank you very much for your presentation. To the members of the task force, please understand the purpose of the Sunshine Law in its very essence is to make sure that the work of government has the full light of day on it, and that people are not making decisions behind closed doors, so that we bring back some integrity and respect to government. Now, as you go through this process, you will be confronted potentially at some scenarios that you may wonder about. When in doubt, err on the side of caution and reserve conversations to another venue. Make sure that any communication that you have, for instance, let's just say, I mean, I'm just giving you some do's and don'ts because I've served on many boards in the past dealing with the Sunshine Law. But as an example, maybe one of you has one of our great researchers has a tremendous paper they've written, and they want to make sure that the members of the task force have it. Great, fantastic. That just has to go through Josh to make sure that he can disseminate it to not only the members, but also to the public, and to make sure that there is no two-way communications. Maybe you have a question and you go, wow, I just got through that entire presentation, I'm not quite sure, tomorrow, and you email somebody that you know in the task force. You can't do that. Just simple things like that you can avoid. At the end of the day, just remember, err on the side of caution, and remember, whether it's Alzheimer's-related issues or any other related issue, you are a de facto member of the government now, and that you would expect that the work of the government be done and open to the public, and that is what we now are charged with in doing ourselves. So if you err on that side, I think everything will work out swell. Now, before the attorney probably heads back to her office and moves on to other things, is there anyone from the task force that has particular questions about the Sunshine Law that they would like to ask the attorney now before she's gone, so that they're for the benefit of the group in terms of interpreting the Sunshine Law? If so, please click the raise your hand button, and Josh will take you in turn.
Christine, I know we were having a problem with the hand raising, but the hand raised, so I just wanted to...
No, again, it's just raising it by himself. I don't have any question. I fully understand the Sunshine Law.
All right, thank
I have
you.
a very good knowledge of it.
All right, thank you.
All right, about this thing.
Dr. Goldie. All right, Dr. Goldie, yes.
Yeah, so just let me be clear. Let's say, for example, Neil and I have a, long-standing relationship working and research things together. Where does the Sunshine Law fall within scope of that? I mean, if we're doing work together outside of the scope of work of the task force, I would assume that, give me some guidance on that. Let me not assume anything. In terms of where does the scope of work of this task force start and stop?
The scope of the task force would be, I think you'll be developing that actually as you begin the organizational meeting and go forward, but it will be to prepare a report as you're charged by the legislation for the governor and the legislature with recommendations about the disease of Alzheimer's for our state in the future. If you have any discussions, I would believe that would be pertaining to the work of the task force in regard to those tasks, certainly those would fall within the Sunshine Law and should not be discussed. You bring up a point that you also do work in the Alzheimer's area, and you might have work-related issues of Alzheimer's. I would think generally those would, if you've done those in the past, they probably would not fall within the task force mandate of this report for the Sunshine Law. But if you're not sure and you have any questions about it, that would be an issue that we want to specifically look at what those conversations might be. And as Representative Hudson said, err on the side of caution, and please let us seek guidance either from the Attorney General's office or through General Counsel's office with the Department of Elder Affairs, and let us give you recommendations regarding issues like that. I hope that gives you some guidance.
Right. I mean, it's just challenging because at this point the scope of work isn't completely defined for the task force.
Exactly.
And then people who have work in the Alzheimer's area and interact already, there's sort of a gray area here until that's defined. I find it a little challenging from that point of view.
I appreciate that it might be challenging for you in your position. But hopefully the organizational meeting today will even help clarify that, the direction of the committee.
Okay.
All right. Any other questions for Ms. Goodson before she leaves? Okay. I don't see any other hands that were raised. So.
Excellent. And Dr. Goldie, you are correct. There is a little bit of gray area, to say the least, and that's why I always kind of stress err on the side of caution. And as you go through and you sit on this board, you'll start to see the various. It'll become very apparent to you when you're heading down the path of, hey, wait, we should be talking about this in the meeting and not here. And so those things will kind of unfold as you start to think about things. I guess the next thing on our agenda is to really talk about the tasks of the task force. and then a little bit about our structure and bylaws. Josh, I believe you have the task of the Purple Ribbon Task Force up first here, so we'll hit that. We've kind of created an outline that was forwarded to you in advance that you can kind of take a look at, but it creates somewhat of a scope, I suppose, for you, Dr. Goldie, and for others to kind of understand what we're trying to accomplish and where we're trying to go. I will tell you that it is a pretty significant amount of work that's in front of us. So let's just review each of these points, but what I would like to do, each of you have this in front of you, and as we go through this and we start setting dates for future meetings and so forth, it's going to be important for us to break down each one of these and come up with our positions on these. Our interim study is due in January, so we don't have to have specific recommendations, but the body of the research should be significantly done by January. And if you have ideas, you have things that relate to each one of these bullet points that you would like to submit for discussion, for review, for analysis, please make sure that you send them to Josh, and Josh will then be able to disseminate them back out to the group. So let's just review what our charge is here. And as we go through these, and I'm sure that at the department there's someone hopefully feverishly taking some notes. As we go through these, I'm going to hit each one and go through the list, and then if we could, if any member of the committee has questions or feedback for any of the particular bullet points to maybe help refine that bullet point, please hit the raise your hand button as we're going along, and Josh will notify me. So essentially our tasks are as follows. Our goal is to assess where the future impacts of Alzheimer's and other related dementias are going to be on the state. That's the overarching theme of where we're going. What will be the impact of this disease? We then have to examine what we have in existence today, what industries, services, resources are addressing the disease now, and caregivers. And I think, from my perspective, that will be one that will be fairly challenging, because as I have traveled the state of Florida as a legislator and have toured many great operations, I find that sometimes there is a bit of a fracturing of the coordination of care. There are some great things being done and might be replicatable amongst other communities, and people just are unaware of them. So after we've taken somewhat of an inventory, then we need to take a look at the needs of the individuals and address all different cultural backgrounds and the other forms of dementia and how their lives are being affected by that disease, and looking at it in all the different stages, from young onset through mid-stage to late stage. And I think the challenge here, and a key for us is the statement of all cultural backgrounds. We have a very, very diverse demographic in this state. We have 67 counties. 42% of our state's population live closer to communist Cuba than they do Tallahassee. We have a great deal of diversity culturally, and I think it will be incumbent upon us to make sure that we are not missing any particular group. And so all of you come from different parts of the states and know your communities well and know the people in those communities. It will be important that we reach out to all the different cultural groups to make sure that we are truly assessing things correctly. At that point, once we've identified what our future looks like, we've taken an inventory of what we've got, we've looked at the needs of the people, then it's time for us to develop some type of a strategy to look at how the state will respond. And with that, there are a lot of different things to be able to look at. First of all, before I go any further, does anyone have any comment or concerns with the basic approach of assessing the future, taking an inventory, examining the needs, and developing a strategy. Anybody have any concerns or issues there?
This is Josh. No questions as of now.
Wow, that's outstanding. Okay, it's either no one has any questions or I've already put people to sleep. Hard to say which one it might be. Okay. And I'm awful glad the lines are muted. Okay, so once we've developed a strategy and start to develop a strategy, we're going to need to put some information together. And I think we have, just from listening, the researchers that we have who are doing the medical work and the scientific work will be a component of this, and certainly some of the folks from the various associations will be able to provide some of this work. But we need to start looking specifically at trends to begin with. Where do we stand now, and what is the trend line for this disease? We have to identify what might be the role of the state in this. There would be some that might argue that the state has no role. There would some that might argue that the state has a complete role. So we will certainly have to look at that and look at how we, as a state, address community-based care, long-term care, how we discuss respite and caregiver support, how we handle education. For instance, are we actually educating our nurses and doctors and dentists and healthcare providers with enough education for them to move forward and assess these things as we move along? We also need to develop a policy that will address the individuals, not just what the state is going to do, but address the policy concerns of the individuals. And then I think it's important for us to also take some type of a measure of just how many people we have in the state with this disease. There are a number of numbers that float around out there, and the various associations are good at putting those numbers together. I would submit to you, and I think that I've heard this from other folks, that oftentimes this is underreported, and so we may be dealing with an iceberg here where we see the tip of it, but we know that the majority of it's underwater. And so I think it'll be important for us to try and assess what the true numbers are so that we can put things into perspective in the grand scheme of things. And part of that information gathering and putting information together for the interim study, we'll also, as part of that inventory phase, we're going to have to really look at what our existing services, resources, and capacity are. We're going to have to think about what exactly is available, the type of service, the cost of that service. Are there better services that might be available, more cost-effective services? We're going to have to look at the policy requirements. You know, when we look at education for nurses or physicians or doctors or CNAs or any different category, well, that's a policy question, and that is something that we'll have to look at as to where we would want to go with that, and that would be in our recommendation phase. We're going to have to look at what are the quality measures that we're going to look for. That was something that was started on this year by Representative Corcoran in the legislature and putting some quality measures in place. And I think that's something that we'll have to be very mindful of. I think one of the things that is something that touched on for me, and I know that Ms. Payne, I'm sure, has spent a career dealing with this, but the capability of our public safety workers and law enforcement officers to respond with folks with Alzheimer's disease. You know, before being a legislator, I was also fire commissioner. So there are just things that we need to make sure that our first responders are prepared for and know how to react to. And then how do we put that training into place? I think one of the other things we also have to do is take some type of an inventory of the availability of our home and community-based services and respite cares, and how best to address that. If we have an ever-growing population, the need for those services are certainly going to continue to rise. We did change Florida law this year to allow for nursing home operators to be able to provide respite care for family members. I think that was a step in the right direction, but again, part of that fractured approach to getting it done. We're also going to have to take an inventory of long-term care facilities to be able to see exactly what we have. You have some nursing facilities that don't have dementia wings. So it's saying we have X number of nursing home beds or skilled nursing beds, if you might say, doesn't necessarily cover it. How many of those units are specifically designed for Alzheimer's, and does that bring up a question as to what and how they should be designed in the future? One of the other things that we should look at certainly is how we handle psychiatric units for persons. We have certainly the Baker Act facilities, and we have someone here that certainly knows about Baker Act. That was part of the categories we put forward. But do you treat the person with Alzheimer's the same as you would treat the person that doesn't have Alzheimer's that gets put into a Baker Act or a crisis stabilization unit? How best do we facilitate that, and how do we differentiate the two, perhaps statutorily? And I think we also have the folks here from the assisted living facilities, and looking at residential assisted living options is certainly going to be an issue. You have assisted living facilities that just are a handful of beds on up to a great number of beds, and how best to handle that, and do all of them take those folks or not take those folks? How do we differentiate that? How do we make sure proper placement is ensured? And then we also, and I want to knock on wood, and you probably can't hear me do this, but I'm knocking on wood anytime I talk about preparedness for catastrophic emergencies. There is a unfortunate periodic tendency for the wind to start blowing in Florida, and we need to address that. How do we handle our special needs shelters? How do we handle the evacuation of facilities? How do we make sure that our emergency preparedness folks, our emergency operations centers, are fully prepared to understand that there's going to be a need for more facilities down the road, and how they prepare for that? Those are things that are important for us to look at. Again, I believe we will certainly have to look at what types of state policies may need to be addressed to make sure that we ultimately bring all of this together. We've talked about an awful lot of little bullet points here, but ultimately the goal is to bring it all together so that we have a unified logistical approach to getting a coordinated care for an individual and for a family. And then I think it's important for us to also, and this is in keeping with the Sunshine Law, there will be many times when there are members of the public on our calls, members of the press and so forth. I think it is important for us to make sure that we are reaching out to the public, and I know that the agency has looked at a few different ways to try and facilitate that, but I think it is important that while the 18 of us that are on this task force share a tremendous amount of knowledge on this particular subject, and certainly y'all more than me, I think it is incumbent upon us to make sure that we do look to the public, because oftentimes some of the simplest things and some of the most common sense things come from where you least expect it, and that's not necessarily from the experts. So we need to make sure that we are recognizing that there's an awful lot of bright people in this state, and we need to reach out to them. And so that is the kind of the outline of the task before us. At the conclusion of that, we will put together our interim study. From that interim study, I would suggest that we will use that study to come up with particular policy proposals that will be put into the form of statutory changes, and those will be part of our final work product that we'll review by August of next year. And I know I've gone through a scat of material here, and at this point I will break for a moment and ask if there is anyone that has questions or comments on anything that has been discussed so far. If you'd like to raise your hand so that we can address those.
All right, Amy Perry.
Hi, I think that this is a fantastic agenda. I guess what I would ask is maybe within it somewhere that we include an exploration of the role and the support of Alzheimer's research in the state. And maybe it's part of the state response to this public health crisis. But as we make a lot of progress in the research area, we are impacting the progression of this disease and the impact for the patient. And so I just think that there's something that should be in this sort of overall exploration that includes the research component.
Amy, I couldn't agree more. I think you are absolutely right on track, and I'm guessing that Dr. Goldie probably had his hand up as well for the same thing. I think that's exceptionally important for us to address, because it's not just what you are doing at your facility or what Dr. Goldie might be doing with his research, but all the research that's going on around the state of Florida. And how does that also tie into the research that might be done at some of our private sector biotech facilities that we've worked so hard to bring to this state. So I think there's a great need to add research to that. And Josh, I would ask you that if you could draft up a new bullet point as one of the tasks of the Purple Ribbon Task Force to address the role that research plays in the state and the kind of an update of where we're at as being a bullet point to be able to address and to address Ms. Perry's comments far more articulately than I'm coming out with right now.
Absolutely, we will add that. Go ahead.
Anybody else with a hand up?
Dr. Neil Graff Radford.
Great.
So yes, thank you. I just want to endorse that point very strongly at this time. You know, we reached a stage in Alzheimer's disease where we think we might really get to prevent or delay the disease. There's some very exciting knowledge that's available and some funded studies that are going to take place to do what we call secondary prevention, where people have a head full of amyloid but they don't have the symptoms, and we're going to try and intervene to prevent them developing or delay the onset of their symptoms. And you know, that really could help solve one of the major health crises that is really affecting Florida. And I think taking part and contributing to the research in that area, I think, is absolutely essential. So I just wanted to point out that we're at that stage now, and it would be very disappointing to have such a skilled task force and not to have that as part of our mission.
So, Doctor, let me just tell you that certainly it was certainly not intended to make that an oversight. It was simply just an oversight. In the House, I happen to chair the House Biotech Caucus, and so I am very keen to the needs of our medical research and making sure that we are finding a way to address this. One of our recommendations may well be that the task force says that the state needs to have a greater role in funding of medical research in the state. That certainly might be within the realm of one of our recommendations. So please understand it was not intended to shortchange the great work that you and your colleagues are doing to address finding a cure or preventative treatment for this. So with that, Josh, is there anyone else with a hand up?
No, that's it right now.
Okay, excellent. I think at this point I just want to briefly discuss a few different things as revolves around just how we'll kind of function as a group. just to reiterate, our structure as appointed members, we obviously have to live through the Sunshine Law and work with the Sunshine Law. We expect that you will actively participate, and you'll certainly have a little bit of homework after tonight. We expect that your participation will also include attendance. It will be very difficult for us to move forward with the timetable we have unless we are getting the support and attendance of the members. We will make our decisions. Oh, I'm sorry. One thing with attendance, if for some reason you cannot attend, then please notify Josh at the department as soon as possible so that we know that you're not going to be there, so that when we have these future meetings we can start on time and we will know that, hey, you're going to be there. If you're not going to be there, we just need to know that too, but we do need to know, just as a common courtesy to all other participants. It will be my desire to start meetings on time, so I would encourage members to try and log in a couple minutes prior to the beginning of the scheduled meeting time so that we can begin on time and end on time and follow agenda throughout. That is how I like to run a meeting, and I think it is mindful of everyone's busy schedule and time, and is also appropriate for the public to know what is going on at the appropriate time. As we come to start making decisions, we will need a quorum of members to do that. We have 18 members on our task force, so a quorum would be 9. So in order for us to make any decisions, we'll have to have 9 members. At the beginning of the subsequent meetings, we will kind of take a roll. That roll will be done probably electronically by Josh, and to make sure that we have the appropriate members. If for some reason we fall out of a quorum or you have to leave a meeting early, it will be, again, important for you to let us know if we are going to be doing any voting. When we come to voting, an approval of a measure will be done by a majority vote, and it is important to know that you cannot vote by proxy. So if you cannot be there, you cannot vote by proxy. And that is the crux of things. We will be meeting predominantly through webinar. If you just happen to be in Tallahassee and want to pop in, they would love to have you there. If you do decide to go to Tallahassee, remember it is on your own time and dime. There is no per diem and no reimbursement for this task force. This is a labor of love, and we certainly appreciate your willingness to serve. With that, I think that goes over how we'll run and conduct meetings and future meetings. Does anyone have any questions or concerns with the proposed meeting bylaws and structure?
Right. Dr. Neil Graff Radford.
Thank you. Looking at the incredible volunteers on this task force, it would be lovely to meet and actually get to know everybody a little bit better. I wonder if, I know that there are financial restraints and maybe even sunshine law issues, but it would be lovely to meet in person sometime if that is possible. I don't know if that's the same feeling that I have, that others have, but is that possible for future?
Well, and Doctor, I appreciate your comment. I certainly was desirous to see the task force move forward. In doing that, quite frankly, we did not have the resources as a state to be able to provide for travel allowance and travel per diem for the individual members to be able to do that. We are always free to meet. It is not a sunshine law violation for us to meet because every one of our meetings, be it webinar or in person, are publicly noticed. However, facilitating the travel and so forth would be on the individual's members' own expense. And there are not resources available and were not appropriated for that purpose. And so that will be a discussion that we might want to look at I don't necessarily think it would be appropriate for one of our first couple of meetings. It might be appropriate for when we look at putting together the final report of the interim study or the final report that will ultimately have the recommendations. One of those two times perhaps, but again, it will be of the up to the will of the group if they wish to use their own resources to be able to facilitate an in-person meeting.
Representative Hudson, I think Secretary Corley had a comment to add as well.
Hey, that'd be great.
Representative, we had talked earlier about a forum for public input and all other than, just the website and all of that. And what we had discussed, while we have not worked out the details on this, is maybe making available for one of the meetings, making available a couple of sites in urban cities throughout the state, or, in the middle of the state and south of the state and something up here maybe, so that we could have 3 different meeting areas that people could come to. Again, as you emphasize, it would have to be of your own resources, but we can make it a little more convenient, maybe a little closer to your home, so it's maybe only an hour or so drive away, hopefully, and that way we could facilitate the attendance and input by the public, and it might also quasi-accommodate what we were talking about here, the advantages of meeting together. So I offer that up for a future meeting as well.
I think that's a great idea, Mr. Secretary, and I think that, again, it certainly wasn't appropriate for this first meeting. I think it would be great for you to kind of keep going down that path and pressing out those wrinkles to see how it can best be facilitated. And let's look at that as a future idea, and I'm certainly in support of it. That'd be great. I'd certainly like to meet in person the people on the task force. We got some fantastic people here that care about their communities, care about their state, and maybe some people on this task force that might just find the cure to change the world. So it'd be kind of cool. Anybody else have any questions?
No, that's it for now.
Okay. The next thing on the agenda was a discussion of some other state plans, and Secretary Corley.
What we have done is, I mentioned earlier at the beginning that Mindy Solish, who is basically our strategic planner here, did a little background and looked at what other states have out there and sort of pulled out, I think, a few models that she wanted to sort of point out that might be the committee or the group might consider for which direction you want to take in terms of the format and the model for the report of the plan going forward. And also, if that's okay with you, Mr. Chair, I'll turn it over to Mindy Solish right now.
Mindy, the floor is yours.
Thank you. Good afternoon. My name is Mindy Solish. And House Bill 473 certainly spells out what will be in the plan, but not necessarily how it will be formatted. So as Secretary Corley explained, I reviewed a few of the formats that other states have used. What I have up on the screen here is a very high level, an overview of what Representative Hudson had already described, which is what the requirements are for House Bill 473. And I just wanted to review those quickly. So the first thing we need to do by January 30th is define state trends with respect to persons with Alzheimer's disease and their needs. And then the final report that's due August 1st, 2013, is to include current and future impact of dementia on Florida, existing resources and capacity, needs of persons with dementia, and recommendations. I did want to thank the Alzheimer's Association for making available a link to all of the state plans that are available. They also developed an issue kit that Josh had given to me that we have only a hard copy of, and we'll try to make that available to everyone electronically. And I did want to point out Appendix E in that plan, and we will make all of this available to everyone. This was Their recommendation, the entire issue kit is their recommendations for how to put together a state plan, and it's really very informative. And what they've done in their example is they've organized information about each topic together with the recommendations. And you can see the different topics that they've used here: home and community-based versus residential care, diagnosis and treatment, financing, long-term care, home and community-based services, residential services, education and training, and public health. But what several states have done was formatted their state plan actually quite differently. They instead had a large section that had all the information about the current set of services and gaps and the other information about trends in their state. And they had a separate section with recommendations. And there are 3 state plans that I wanted to review: Oregon, Colorado, and Louisiana. There were some interesting ideas that they used that we also might want to employ. Okay, so the first plan I wanted to talk about was Oregon. Oregon's plan, they start out with acknowledgments. They then have the list of the task force and work group members. And something else I wanted to point out too, we're going to talk about the structure of these plans, and that might also be very useful for trying to figure out how we are going to organize our work groups if in fact we decide to develop work groups as Oregon has. Then they have a letter of support from their governor. Okay, and this is their table of contents, and what you see, what they've done here is they have identified 5 different goals, and this is one of the techniques that some of the states use. They identified goals, and then they identified the recommendations within those goals. So that's one option that we can employ. And I wanted to just briefly show how they organize the information. So this is their first goal, is enhance public awareness and engagement. And so for each goal, they have 1 or more recommendations. For each recommendation, they have strategies, rationale, lead organization, so who is it that's responsible, and the time frame and measurable outcomes. Not all states had measurable outcomes, and also the fiscal implications. So that's one way to organize some of the information that we're required to present. And I also wanted to show a resources section they have in their appendix, Appendix C. And all these plans, we'll make these 3 plans available to you all to look at this a little more closely. For the next, I think, 5 pages, they identified all of the programs and resources that were available in the state. Okay, next I wanted to show you Colorado's plan. And as you can see in their table of contents, their first 5 chapters were informative. They have their chapters are a little bit different. They have an introduction that has prevalence of the disease in both the country and their state. Their second chapter is on the availability of long-term services and supports. Third chapter is on financing. Fourth chapter is on quality of life and quality of care. Fifth chapter on public safety. And their chapter 6 is where they identified both the gaps and policy recommendations. And I wanted to scroll down and show you how they grouped their recommendations. So unlike Oregon, who had their goals, their 5 goals set out, and then within each goal they had their recommendations, what Colorado has done is they've defined different categories, and within those categories they've identified their recommendations. And their categories are formal services / workforce development, informal services and caregiver support, quality of care and Alzheimer's disease research, and lastly, public safety and public awareness. Okay, and the third plan that I wanted to bring up was Louisiana. There was a few things that were very unique about their plan. They had identified their current services and the gaps in those services by the stage of dementia. I believe this was the only plan that had organized their data in this way. So they organized it by the 7 different stages of dementia. Thought that was very interesting. And the other thing I wanted to show you that I thought was very interesting as well and could be very useful is they pulled out all of their recommendations and identified when they wanted those to be completed by. So they have a list of those recommendations they wanted to complete by the end of year 1. Then they had those recommendations that they wanted to complete in years 2 and 5 and beyond 5 years. So those I thought were just some interesting ideas that we could adopt. What I did, it might be useful for folks that are going to be contemplating how to organize our plan. I just took the categories used by those 3 states and put them in this Word document. And you can see that Colorado and Louisiana, their recommendation, they just had recommendation categories versus Oregon, who actually set up goals, which was also similar to the national plan to address Alzheimer's that's available on the internet. So there's just a couple of different ways that we can approach our state plan. And then the other thing I wanted to mention was that several states had conducted a survey, and they had included the results in their state plan. And the goal of the survey was to understand the experiences that the citizens in their state have had relating to services and supports for people with dementia and ideas for improvement. And as Secretary Corley had already mentioned, the department can assist in the development of a survey. If we are interested, we can make that survey available online. We could all make that survey available on our website. One thing I did want to point out was in that issue kit that Alzheimer's Association has made available, there is a sample survey. I believe it's Iowa's survey that's shown. All of the questions, or most of the questions, are open-ended questions. And I believe I have an example of open-ended questions. I just wanted to discuss this. If there is interest, I think what we'll do, the department will put together a sample survey within the next week or so, and we'll send that out for everyone's review. And if there's interest, we can find that out on our next meeting. Then we can work together to formulate the questions. But there were many open-ended questions in Iowa's survey, and I just wanted to make the point that the results of those surveys with open-ended questions are very difficult to analyze. They certainly can be. It just requires more time. So we might want to consider having closed-ended questions, or maybe even both, maybe even a hybrid, so that we can find out how satisfied people are with the services that are available to them, and then we can also give them the option of providing some detail about their experiences as well. So that was all I had. Are there any questions?
Well, Mindy, thank you very much for your good work and your research thus far. I'm looking forward to seeing all those plans. Am I to understand that we'll get links to all the different plans as well as the survey information?
Yes, that's correct. We'll make all of that available.
Representative Hudson, there are some members of the task force that do have questions, so if you like, we can recognize them.
I think that'd be a great idea.
Right. Amy Perry, go ahead.
Hi. First of all, thank you. I think that the reports are very interesting. And I actually want to add one more. The comprehensive plan for the state of Texas on Alzheimer's disease, there's one that they have a 5-year plan from 2010 to 2015 that does have specific goals and objectives and strategies. I think it is a very helpful framework, and I would also suggest that the committee also takes a look at this format.
Sounds like a great idea.
And I could email that, I guess, to Mindy, or I send a link to Josh or something maybe.
Just email. Let's make one point of contact be Josh. Sorry about that, Josh. But your inbox just got really full. But let's make one point of contact, Josh, and send a link to that report, and then he can send that out to everyone and post it on the website.
I'll do it. Thank you.
All right, and we do have 8 minutes left before we run out of time, but we do have a couple more questions. Mary Barnes?
Hello, Josh and everyone. I've read, I've got a couple of plans I've been reading. One is the California State Plan, an action plan for 2011 to 2021. Very interesting, probably much more in line with what's going on with Florida. A lot of the states that you recommended for state plans, I understand you were dealing with really the organizational structure. I understand that. But when you look at the outcomes, just like California is, we in the state of Florida, the talk and the talk is kind of hard for us. We've got to start walking the walk because we have so many families. I agree with also the recommendation of Texas. I have studied that one as well. And another very, very good one was the action outcome plan, the action plan of Oklahoma. They did a very good job, and again, they had measurable outcomes. They have assigned deadlines and on different issues, and that was done in their report came out on September 1st of 2009. So,
Ms. Barnes, if you would be so good as to email the links to Josh, we'll certainly put those into consideration. Again, we're not necessarily looking at anything more than the structure of how we format the report, less of what's in it right now and more of just the structure of how we want to put all this data together. I will say one thing. We are publicly noticed until 5 o'clock, so we do have to cut off at 5 o'clock. So I hate to cut you short, Ms. Barnes, but I think we have one more person with their hand up. We need to grab them real quick before we run out of time.
Yes. We did have a question from Christine Powers asking if we're going to form committees to address these issues. So that certainly is something to consider for the upcoming meetings.
It is something to consider, and I think that'll be something that we will do. I think it's important that we try and break up some of these tasks to particular people's expertise and work through it. We may have separate subcommittee meetings that are publicly noticed to be able to facilitate that. In terms of future meeting dates, Josh, I think you and your team helped facilitate this first one by kind of figuring out everybody's schedule. Since we do have kind of a short window to get this done in January, I think I would defer to you and the Secretary as to how best to facilitate our upcoming meetings and the timing of it, but I would suggest that we should be on, before we get to the holidays anyway, probably once every couple of weeks to be able to maximize our time before people start traveling and those types of things associated with the holidays that come into the December time frame.
We will definitely work on that and get input from the members and get that schedule put together. We do have a question from Scott Solkoff and then Natalie Kelly.
Excellent.
Get those in.
Scott, hit it.
All right, very quickly, thank you, Mindy, for those presentations and those samples. I'm wondering how far, in terms of structure, we need to be thinking about going at this point in terms of scoring the economic impact of our recommendations. The states handle that differently, so I wonder if there's any comment yet on that.
I will tell you that I think it's appropriate, no matter what we do, to have a fiscal analysis. I passed a bill a couple of years ago that allows the state to actually start to do some dynamic scoring of legislative measures. So I'm not sure we need to score it, but I think we do need to at least come up with some type of a fiscal analysis so that the legislature can then determine whether or not, since they appropriate, whether or not it would be an appropriate expenditure for the state. But a very good point, very good point. Being the budget guy, I love that kind of stuff. Natalie Kelly, I think you had one question, and we're going to have to cut her off here.
Just one comment. After reviewing almost all state plans, I would actually recommend Massachusetts to look at because it's well organized and very simple, and I think this could be a format that we could use.
Okay, we'll certainly add that to the list. If you'll make sure that Mindy gets a copy of that through Josh, that we can all get back out, that'd be great. Members, I want to thank you for your engaged participation today. I want to thank you for making yourself available for this. I want to thank you for all of the hard work that you're going to do. Expect to see some feedback and a number of emails coming your way in the next couple of days. And I want to thank you very much because I think we're really going to do good stuff. And so with that, members, thank you for your confidence and your vote to make me the chair. And with that, meeting adjourned.